Hi, this is your video lecture on the postpartum content. I'm going to be following right along with your PowerPoint, and we'll just touch base on some of the things and really expand when we are in class together. But for starters, the postpartum period is from the fourth stage of labor, basically. It is from the recovery period up to 1 to 4 hours, up until 6 weeks is considered the postpartum period. It is a period of retrogression in the process of involution, which we're going to talk about here in a second. So what happens is that when the placenta detaches and it is removed, starting the fourth stage of labor, the placental site is very crucial in uterine involution. And involution is that uterus going back to normal. First off, it heals by the process that we call exfoliation. So when the placenta separates, there is remaining decidua. And if you remember correctly from our antepartum discussion, this is what forms that maternal side of the placenta, and it helps generate the lining of the uterus so that the next time that they get pregnant, there'll be a place for it to implant. And this is normally the process. Sometimes it changes when people have multiple C-sections that would interfere with implantation. Now, the first hour is most dangerous. It's the most dangerous time for postpartum hemorrhage. However, the first 24 hours is pretty kind of like our time that we really look at it. When the uterus becomes relaxed, we call that boggy, but it's called uterine atony. So remember from our lab when you were actually kind of like feeling the fundus, and if it was soft, we called that boggy. So what happens is, and that's one of the reasons why we hang Pitocin either like at the shoulder or right after the placenta is delivered to help facilitate uterine contractions to control bleeding. Now, women have different types of after pains. Now, women who've had more babies are going to have stronger after pains. Women who have their uterus has been distended a little bit, whether because of too much fluid or too many babies or a big baby, is going to have more after pains. And the after pains is caused by the oxytocin, and oxytocin is released and stimulates the milk ejection reflex. So for women that are breastfeeding, they're going to have more of those after pains as well, but they also get back to their pre-pregnancy body as well too. So anyway, so those are just some of the things that happens with the uterus, and that's in the placenta site, and that's one of the reasons when the placenta is delivered, we actually check it out to make sure that it's intact. Because if you recall, when you have the wall of the uterus and here the placenta was attached to it, when it detaches it has all those spiral arteries. Okay, so that has to contract it in order for, otherwise you'd bleed. Okay, so if there's like pieces of the placenta that are stuck there, that part is not going to contract, and that could lead to bleeding. So that is an issue. So involution, as I had mentioned just a few minutes ago, is that process where that uterus goes back down to normal. Okay. So first, the area where the placenta was implanted is sealed off, and that's those contractions, and then the organ, actually the placenta, starts to shrink in size, and all of this happens because of contractions. All right. So vagina and perineum actually go through a lot of changes as well. So the vagina and the introitus are greatly stretched during childbirth. Right after childbirth, the vaginal walls are bruised and swollen, and even though it looks like it's healed in a couple weeks, it's more like 6 to 10 weeks before everything is back to normal. Ovarian function takes a little bit to get back together too. And then also estrogen production is still down. So if women are having sexual intercourse sooner than later, they may experience vaginal dryness, so they would have to use lubrication. With episiotomies or lacerations, the pelvic floor stretch and they thin due to the hormone relaxant for the childbirth process. So whether it's through an episiotomy or for a laceration repair, a lot of that it takes time for that to heal. Hemorrhoids are also an issue, either because of constipation or because of everything being stretched down there. So ice is a woman's best friend. We'll talk about some other comfort measures in the future slides. Cardiovascular adaptation. So at term, the pregnant woman is going to, remember, she has this increased volume, like a lot of volume, like up to like 45 to 50%. And this is because so that she can handle blood loss after delivery without any ill effects. So again, thinking about losing a half a liter or a liter of blood and not having any symptoms is the reason why this phenomenon happens. Okay. But there's a couple things that happen. So cardiac output, even though it increases, despite losing blood, it does go up for a short time, about 48 hours. And this happens because of a couple of things. One, blood is returning to the heart quicker once the cord is clamped from the uteral placental unit, decreased pressure of the vessels from the pregnant uterus, and all that excess fluid is going back to mom. So mom has to be able to handle all this excess fluid that's coming back to her cardiovascular system. So along with cardiac output, stroke volume is up, but it does return in a few weeks, like 6 to 12 weeks. We know that there's extra blood volume just due to the extra volume. So one, we got to get rid of it somehow, and there's two ways we get rid of it, and that's through diaphoresis and diuresis. So it's not uncommon for, anywhere from 2 to 5 days after delivery that a woman is like sweating like crazy at night, or she's urinating like 3,000 cc's a day. So that is how we get rid of that extra fluid. One of the things that I do want to remind you of too is that, remember when we had talked about in pregnancy, women are hypercoagulable. Well, you continue to be hypercoagulable even after delivery. So increased clotting factors continue to be up for several days after delivery, causing this increased risk for thrombus. So if anybody has a history of that, that should be known, and these women are put on some medication for that. It takes a few weeks for it to get back to normal, okay? Hemoglobin hematocrit sometimes is difficult to interpret because it's diluted within the plasma, but that also takes a few days for that to get back to normal. Vital signs: temperature is usually up for the first 24 hours due to dehydration, but it really shouldn't be above 100.4. If it is, consider what else is going on with the patient. Pulse is initially up, but then it decreases. But if somebody has an increased pulse and it's rapid and thready, what could that be? So we'll talk about that in class. Respirations should be normal. Blood pressure should be normal. If down, think that they're bleeding. If up, they may have other like pregnancy-induced hypertension or preeclampsia. Pain, again, you're assessing pain with every visit into their room. After pain, so those postpartum contractions, Tylenol, Motrin usually do the trick for that. Muscle aches, Tylenol, Motrin, the same thing. You think about it, they're tense and they're pushing and they're in pain and it hurts. Episiotomy, lacerations, any type of perineal care. The warm water bottle is really nice. There's Dermaplast sprays, and that's like a spray lidocaine, and that is and that kind of numbs up the area pretty good. Also, the witch hazel pads or tuck pads that I know that you think that they're for hemorrhoids, which they are, but they also can be lined on the perineal pad to help with decreasing swelling of the like laceration repair site or the episiotomy site. Okay. As far as like Norco or anything like that, we tend not to use that unless we base that on a situation. Like if somebody has a 4th degree or they had a hematoma or they're just in unbelievable amount of pain, then we need to assess that a little bit further. Some of the endocrine adaptations, placental hormones, after delivery of the placenta, estrogen, progesterone, HPL decline pretty fast. HCG kind of sits around a little bit. If mom doesn't breastfeed, the pituitary hormone prolactin levels, which stimulates milk production, will return to non-pregnant levels. If you're not going to breastfeed, menses return in about 7 to 9 weeks. And this is not science on why contraceptives are very important, because some women will have menses before that first cycle, but some ovulate and boom, they're back with us in L&D very shortly. So breastfeeding does delay both. However, you want to make sure that that you're using a different type of contraceptive. Estrogen and progesterone decline as soon as the baby is born, and we know that prolactin initiates milk production. We also know that oxytocin is responsible for the letdown reflex, but once the baby starts sucking, it has to do that to keep it going. Moms lose about 10 to 13 pounds with childbirth. The baby, the placenta, the weight loss, the diaphoresis. So that's kind of like what that's all about. Getting into your skin, everything, the linea nigra, the mask of pregnancy, All of that starts to go back to normal. Some of the musculoskeletal changes, relaxin, estrogen and progesterone relax the joints after childbirth. Those decline after childbirth. They might just be a little bit sore afterwards. Fatigue, activity intolerance, hip and joint pain, abdominal changes are all different. Let's see, what else do I want to say? Some gastrointestinal adaptations. So women are starving and thirsty afterwards because we starve them during labor. Um, Constipation is common. Remember, motility is decreased during labor, so it takes a little bit for that to get going. So women might want to be careful about just eating that, that big heavy meal after delivery. In addition, they may be afraid to move their bowels because if they have any type of laceration or episiotomy repair, or they have hemorrhoids already, they may be afraid. So stool softeners are another great thing for moms after delivery. Kidneys return to normal function 2 to 3 months. Remember, trace protein is okay. Ketones is probably going to be there because moms are dehydrated because everything goes to the baby. Overdistension and urinary retention is possible. So again, especially in the early postpartum period, you want to make sure that you are checking the bladder, because if the bladder is distended, it's going to distend the uterus. It'll displace it, and that would makes it unable to contract down. So we'll talk more about that in class as far as what we do, for that boggy fundus, either whether you massage or you take them to the bathroom. There's a couple different scenarios that we'll talk about. Initial assessment, labs. We don't normally do labs unless there's like a bleeding issue. So hemoglobin or CBC and diff is okay, but bubble hearts is that you really need to know for quiz purposes, for test purposes, and that's that acronym that's in your PowerPoint. We've talked about it. It's in the video that's under postpartum, so make sure you take a peek at that. You're going to need to know about that for a lot, not only for your assessment, but for quizzes, as well as for testing purposes and why we do what we do. So make sure you check out that video before class next week. So as far as medication that we give, so I already talked about Pitocin. We give that in the 3rd stage of labor, and that is to facilitate uterine contractions to control bleeding. There is other medications that we give that I will talk about when we get into postpartum hemorrhage, which is, I believe, next week already. So I'm not going to really go into that. One of the things I do want to make sure that you look at this picture in your book too. This is pretty important, this picture right here. And on where the fundus, that top of the uterus, should be. And where that should be is at or above or just below the umbilicus at between 12 and 24 hours. By the second day, it starts going down like a centimeter a day. This is a general rule. There could be, little bits of variations, but not too much. Okay, so one of the things is that and it's kind of like a guide on involution. So if it takes a long time for the uterus to get all the way down, then there's a problem. If you still feel the fundus at 14 days, there's an issue, and you need to have that checked out. So how we document it is like fundus firm at U, which is fundus is firm at the umbilicus. If it's 1 finger breadth above it, it's +1. If it's 1 finger breadth below, it's -1. And that is also like if you're finding the uterus way up and over to the side, it could be because of the bladder. So again, we'll talk about those different scenarios in class. As far as make sure you know the differences between the type of lochia. Lochia is the discharge that happens, rubra, serosa, and alba. And it's very important that you know, because if you're having rubra on day 12, then there's something going on. There's something wrong. Rubra is usually the first of 3 to 4 days, followed by serosa, which is like, up until 10 days, like 4 to 10 days. And then alba is like day 11 up to 2 to 6 weeks. So it's really important that you know what that's all about. So make sure you're looking at that. We continue with that RETA assessment that you learned in tissue integrity a couple weeks ago. So again, whether it's your episiotomy site, whether it's your laceration repair site, or even if it's a C-section, this is still considered postpartum, so you still need to assess that. And then let's face it, emotions, psychological changes, it's a big thing, that happens to a woman, her significant other, and their family, whether it's siblings, other children, grandchildren, that kind of thing, grandparents. There's three phases that a mom goes through, and it's called Reuben stages: taking in, taking hold, and letting go. Taking in is like when it's a time of reflection. It's for the first couple of days. It's all about mom, where she needs to talk about her birth experience. What was good, what was bad, and just take care of me. She gets in a very dependent mode. Followed by taking hold, which begins. Mom is more independent with herself and baby. It's a great teaching time as well. And then letting go is where giving up her former lifestyle. The fantasy baby, like she got a boy instead of a girl, and she wanted vice versa, or a C-section instead of a vaginal delivery. Sometimes there's failed expectations, but they start to get into that acceptance mode. So those are the Reuben stages. And then again, how you bond with your baby is really important, like the NFOS and, looking at the newborn, taking care of the newborn, introducing the siblings to them. So there's a lot of things that go into that. Making sure you look at on the slide that talks about promoting comfort, rest, and exercise. So, things that we can do that we talked about: the Tylenol, the Motrin, the sprays, the Tux pads, the warm water. Breast care, what you do with the breast, whether you're breastfeeding or not breastfeeding. Resting when the baby rests, if at all possible. Taking care of yourself, whether recognizing the baby blues, which is like a hormone, as your hormones get back together, is like a period of depression versus postpartum depression. So those are just some of those things. Preventing infection. ROGAM, remember, if they're Rh negative and that baby is positive, so they do that Coombs test. So if that baby comes back positive, then that mom has to get that ROGAM test within 72 hours. If mom is rubella equivocal or rubella non-immune, we give them the rubella after pregnancy. And, there's different tasks that parents take, age, social support, socioeconomic status, previous experience, the baby itself, and discomfort and pain. So, there's a difference between a 14-year-old and a 27-year-old, and the same for a planned and unplanned pregnancy. Who is our support system? Culture dictates a lot at the time of birth and death, and socioeconomic status. Face it, it's very important. If you have the means, you're going to be able to provide differently. Previous experience, plays an important role on how you're going to parent, whether or not you have a good experience or a bad experience. If you have a healthy baby or not a healthy baby, and when you're in pain, you just don't handle anything very good. So those are just some of the things, signs and symptoms of potential complications, discharge teaching. We can talk about that in class. And then there's a case study that we'll do, and then that's about it. So have a good day. Talk to you soon.